Hello, and welcome to Drugs in Dermatology. In this video, we will be discussing the only currently FDA-approved anti-interleukin-31 agent relevant to dermatology, Nemolizumab, marketed as Nemluvio. This drug represents a unique approach to skin pathology. Rather than targeting the cytokines responsible for inflammation alone, Nemolizumab targets the cytokine associated with itching itself. An important note is, although this class of drugs may be utilized for a wide range of treatments, we will be looking through a dermatology lens focusing on dermatological diseases that are FDA approved. So, let's break it down. Drugs in dermatology style. Nemolizumab is a humanized monoclonal IgG2 antibody that targets the interleukin-31 receptor alpha subunit. Interleukin-31 is a cytokine primarily secreted by Th2 effector memory T cells, monocytes, macrophages, mast cells, and eosinophils. It acts as one of the most potent irritogens identified in dermatology, directly stimulating sensory neurons to generate the itch sensation, while also driving downstream inflammation, abnormal keratinocyte differentiation, and fibroblast activation in chronic pruritic skin diseases. In clinical practice, Nemolizumab has two dermatologic indications: prurigo nodularis in adults, and moderate to severe atopic dermatitis in patients aged 12 years and older. It is the only biologic specifically targeting the interleukin-31 signaling axis, and, as of its approval in 2024, represents only the second biologic after dupilumab approved specifically for prurigo nodularis. Nemolizumab was originally developed by Chugai Pharmaceuticals, with global development advanced by Galderma Pharmaceuticals. Early Phase 1 and Phase 2 studies between 2014 and 2016 established tolerability and key pharmacokinetic parameters, supporting monthly dosing. In 2017, the X-SIMA trial was a 12-week randomized double-blind placebo-controlled trial in 264 adults with moderate to severe atopic dermatitis, in which all monthly Nemolizumab doses significantly improved pruritus, establishing the rationale for interleukin-31 receptor blockade in dermatology. A 52-week long-term extension published in 2018, confirmed sustained efficacy through 64 weeks. A Phase 2b study in 2020 transitioned the program from weight-based to flat dosing, selecting 30 milligrams every 4 weeks with a 60 milligram loading dose for Phase 3. Phase 3 trials followed across both indications. In prurigo nodularis, Olympia 2, published in October 2023, and Olympia 1, published in 2025, both met their co-primary endpoints of itch response and IGA score improvement. In atopic dermatitis, Arcadia 1 and Arcadia 2, published in 2024, enrolling 1,728 patients, met co-primary endpoints of IGA score success and eczema area and severity index scores, with pruritus improvement observed as early as week 1. In August 2024, the FDA approved Nemolizumab for the treatment of adults with prurigo nodularis. In December 2024, a supplemental approval was granted for moderate to severe atopic dermatitis in patients aged 12 years and older. Currently, Nemolizumab holds two FDA-approved dermatologic indications. The first is prurigo nodularis, approved in August 2024 for the treatment of adults. This makes Nemolizumab the second biologic ever FDA approved specifically for prurigo nodularis, following dupilumab's approval for this indication in 2022. The second is moderate to severe atopic dermatitis, approved in December 2024 for patients aged 12 years and older, in combination with topical corticosteroids and/or topical calcineurin inhibitors. The mechanism of Nemolizumab operates on 4 interconnected levels, each directly relevant to the pathophysiology of both prurigo nodularis and atopic dermatitis. First, the anti-itching effect. Interleukin-31 is one of the most potent pruritogens identified to date. It directly stimulates sensory neurons generating itch signals that propagate centrally. Nemolizumab blocks interleukin-31 from engaging the interleukin-31 receptor, rapidly interrupting itch signaling. Clinical benefit in trials has been observed as early as day 2 of treatment, which is an unusually rapid onset for a biologic, and reflects directness of this target. Second, the anti-inflammatory effect. Interleukin-31 signaling activates downstream Th2-associated pathways, including interleukin-13 and Th17 pathways in the skin. Analyses of skin biopsies from treated patients demonstrate suppression of these inflammatory signatures following Nemolizumab treatment. Third, neuroimmune modulation. Interleukin-31 receptor alpha subunit is expressed not only on sensory neurons, but also on keratinocytes and immune cells. Blocking this receptor modulates the neuroimmune crosstalk that characterizes both prurigo nodularis and atopic dermatitis. Fourth, an anti-fibrotic effect. Relevant specifically to prurigo nodularis, interleukin-31 signaling appears to contribute to the maintenance of dermal fibrosis in prurigo nodularis lesions. Nemolizumab's blockade of this axis may contribute to the progressive healing of nodular lesions observed in the Olympia trials. Nemolizumab's safety profile is generally favorable, with adverse effects differing modestly by indication. In the prurigo nodularis trials, Olympia 1 and Olympia 2, the most common adverse effects were headache, eczematous reactions, facial edema, with all events described as mild to moderate and non-serious, and asthma. In the atopic dermatitis trials, Arcadia 1 and Arcadia 2, the most common adverse effects were headache, arthralgia, urticaria, myalgia, facial edema, and worsening of atopic dermatitis. Serious adverse effects were uncommon. One case of bullous pemphigoid was reported in the Nemolizumab group in Olympia 2. Hypersensitivity reactions, including facial angioedema, have been reported and are highlighted as a warning on the FDA label. The sole absolute contraindication for the FDA label is known hypersensitivity to Nemolizumab or any of its excipients. Facial edema has been specifically reported. The label instructs that the drug should be discontinued immediately if a clinically significant hypersensitivity reaction occurs. Additional precautions function as practical clinical considerations. Live vaccines must be avoided during treatment, and all age-appropriate vaccinations could be completed prior to initiating therapy. The safety of Nemolizumab in pregnancy and lactation has not been established. It is unknown whether the drug crosses the placenta or is excreted in breast milk, and this uncertainty should be discussed with patients of childbearing potential. As always, we will close our video with a table going over the main talking points. I hope you have a better understanding of anti-interleukin-31 therapies. This is meant for educational and informational purposes only, and should not be used as a substitute for medical advice, diagnosis, or treatment. Thank you for watching, and see you in the next video.